Hi, I'm Medicare Mama from TikTok, here for a brief explanation of what Medicare Supplement Plan F is. Now, you've probably heard from your friends or family that F is the best plan. And that is because Plan F was the richest plan, the most benefits, the least out of pocket for 45 years. But you can't get it if you are just now turning 65. They changed the rules January 1st of 2020, and people that are turning 65 after that date cannot get Plan F. Don't feel bad about it because you don't want it anyway. All the millions of people that are on Plan F, all your friends and family, they probably need to get off Plan F if they can. Let me explain a little bit how it works. When you say nobody new can buy Plan F, so think of this as an iceberg. We have healthy people on it and sick people on it, and more healthy people come on it every year, people turning 65. That iceberg stays healthy because there's an influx of new people, younger people, to make up for the people that are in their late 70s, 80s, 90s that are spending a lot of money. When they said no more people can buy Plan F January 1st of 2020, anybody that was going to turn 65 after that date, that iceberg broke off and it's just out there floating. And now it only has the people that were on it. They're not getting healthier. They're getting sicker and older. So the rates have to reflect the claims on that iceberg. And they're going to go up, 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 up because no new healthy people can buy it. So, I'm not trying to dumb this down too much and insult your intelligence, but that should make sense to you. Versus over here, we have Plan G, which became the most popular plan in America after January 1st, 2020. Everybody that is turning 65, everybody that's losing their group health insurance after 65, they can buy this Plan G. So people are on it getting older and sicker, but there's always healthy young people coming on it. So it's a big, healthier block of business. So versus that one that's out there sailing by itself with just old, sick people, this one will maintain its rates better. If you don't believe me, you can Google Medicare Supplement Death Spiral, which is something when the law was getting ready to change in 2018-19, that they made us insurance agents, they basically put a gag on us. And they said, do not talk about a death spiral because they didn't want everybody to get off Plan F. Well, I don't work for the government. I work for my clients. And so your agent should want to do what's right by you. And that means your agent should talk to you about F versus G. So if you were turning 65 before January 1st of 2020, you can still get an F. All those millions of people, they can get an F. Just new people can't get an F. So what's the difference between F and G? So this is F, this is G, without being able to read this. Only thing it doesn't have is the Part B deductible. If you buy a G, you must pay one-time annual deductible. And it'll change every year, but it's around $200 for 2022. Okay, so you're going to pay that $200. But when you look at the price, the G is going to be much more than $200 cheaper than the F. Okay, so even though you have to pay the deductible, you'll probably save $300, $400, $500 getting off your F. So that's why if you have friends, family, if you help your neighbors, your grandparents, your parents, and they're on an F, we might be able to help them get off of it and get onto a G. It depends on where you live, what state, what their circumstances are. For example, there are certain states, New York, Washington, California, Missouri, Idaho, Nevada, Oklahoma. There's certain states, Illinois, where you can switch regardless of your health. The vast majority of the country, Kentucky, Tennessee, Ohio, Indiana, the vast majority, if you're already sick, if you already have congestive heart failure or COPD, Parkinson's, you already have something big, you won't be able to answer the health questions to move from the F to the G. So as your plan continues to go up, you start to panic because your Social Security is not going up. You're on a fixed income. So every year you kick the can a little bit further down the road. So that's why call us here at the Medicare Family. It doesn't cost you anything for us to research it for you and find out if in fact you are eligible to move based on your health and the state that you live in. There's a phone number on the screen. Or you can ask in the comments down below. Tell us when to call you. So let's go to my whiteboard here and let me talk a little bit about another difference between the F and the G. So the F is going to go up like this. Kind of goes up like a rocket. Now that will depend on what company you bought it from. Did you buy it from a small regional company or did you buy it from one of the largest companies in the country? Typically, the larger the company, the more stable the rates, okay? So if it's a company that you know the name off the top of your head, that is a large national carrier. Plan G will go up like this. Okay, it's still going up a lot. These plans are both going up 5 to 10% a year, forever. Some years will be worse than others. So G is slightly better. Now Plan N, which is my favorite plan, Plan N goes up like this. Much, much, much slower. So in the first couple of years, you're like, whatever, save 20 bucks a month. I don't care. It's not worth my time to mess around with it. But as you get older and older and older, when you're playing tennis with your friends or bridge with your family and you're comparing prices, that's when you're going to find out you were the smart one because you got off of an F either to a G or an N, and your rates are going up much slower than your friends and family. So let's go back a little bit to F versus G. Like I said, if you're turning 65 after January 1st, 2020, you can't get it anyway. Okay. So I'm just saying this to allay your fears that you're like, well, dang it, I want that. No, you don't. And the people that have it don't want it either. But when you look at that, the difference between the F and the G, the price difference here on this sample, which is just based on just one person, one state, it's about $40 a month cheaper. Okay. That's a good savings. And that $40 over a year, that's $480. You only have a $200 deductible. It makes sense. So even if you could buy an F, okay, if they hadn't have changed the law, you still wouldn't want it. And most of us that specialize in Medicare, we stopped selling F many years prior to this last law change because we knew this was going to happen. We all switched to G. If this video was helpful, check out the other videos on the different pages on this website where I will go into more in-depth on Plan G, on Plan N, on Medicare Advantage, and drug plans.
If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment. If you have a specific question, always feel free to call us or email us at the Medicare Family.